Hello, my name is Mark Salzer. I'm a professor of rehabilitation sciences in the College of Public Health at Temple University. I'm a psychologist, and I'm also the director of the Temple University Collaborative on Community Inclusion of Individuals with Psychiatric Disabilities. In this segment, I'll be talking about strategies for promoting community inclusion of individuals with mental illnesses, and I'm pleased to do so in partnership with the Ruderman Chabad Inclusion Initiative. The objectives that we have for this segment are to describe practical steps for promoting community inclusion. Some of these practical steps include not doing it alone. It doesn't just have to be on the leader of Chabad. It could be a layperson or a community member who's involved. Promoting community inclusion involves creating welcoming environments and providing individual and family supports to make this happen. One thing that's critically important for you to understand is there is not a how-to manual that exists for how to promote community inclusion of people with mental illnesses or other disabilities, quite frankly. Individuals require individualized approaches, and that's something important for you to be thinking about. So again, a lot of what I'll be talking about are general strategies for you to consider and utilize, but the specifics for a specific individual will be unique. The first thing to keep in mind is do not do it alone, or do not feel like you have to do it alone. You should look into engaging lay members or community members as inclusion supporters or advocates. These could be the individuals who, when you suspect that an individual has a mental illness, or somebody has disclosed a mental illness, or somebody is behaving in a way where you might suspect that there's a mental illness, that this is an individual that you call upon and ask to support this individual and support the broader community in being a welcoming environment. This individual would be responsible or lead efforts to develop a welcoming environment, and again, we'll be talking about this in a few minutes. They'd also be the go-to person to figure out how to deal with each situation that arises and bring it to the community leader with ideas and details. This is a person who can engage that individual, come up with different strategies or ideas, and work with you around how your community can best promote inclusion of a specific individual. Some benefits of this is it takes the time and pressure off the leader needing to do it all on their own, and it brings more community members into the conversation about promoting inclusion. As I said earlier, inclusion means creating a welcoming and embracing environment. That's the whole environment, including lay and community members. It's not just the leader of that community. So what do we mean by creating a welcoming and embracing environment? First of all, it means celebrating diversity. And celebrating diversity is bringing strength to the community itself. It means challenging traditional prejudices and the exclusion they foster, actively seeking out those who have been marginalized, and warmly welcoming, accommodating, and embracing differences. Some specifics that can be utilized in this area are making sure that all outward-facing congressional messages, like the About Us section on a website, newsletters, other kinds of communications with the broader community, mention that you are an inclusive community of all people, including those with disabilities. These efforts could include religious leaders making frequent statements about inclusion that are linked to theology. This can include lay leadership establishing inclusion as a priority, including public statements and establishment of work groups to let people know that Chabad welcomes people with mental illnesses. It includes frequent conversations among congregants about the importance of inclusion and addressing whatever concerns, say concerns about violence or responding to people with mental illnesses that individuals may have. And it sometimes includes creating alternative settings through the use of, for example, video cameras, broadcasting events, quiet or sensory-friendly rooms to promote participation of individuals with mental health issues. So what are some specific inclusion strategies that can be used to promote inclusion of individuals with mental illnesses. The first is to increase awareness and comfort in discussing issues in your Chabad community. This, for example, could include the community obtaining mental health first aid training that is likely available in your community, where the whole community learns about mental illnesses, learns about symptoms associated with mental illnesses, and learns where individuals learn how they can respond to individuals and be supportive of them rather than excluding them. This would also include conversations about how to seek support in your local community for individuals who are experiencing distress. It includes reducing prejudice through contact and conversation. We have ample evidence that religious communities do exclude people with mental illnesses, and increasing contact and conversation about mental health issues is critically important. Your community could also engage with consumer and family advocacy organizations that are local, including Jewish mental health advocacy organizations that might be present. It includes outreach to mental health systems and agencies and the people they serve to let these communities know that you're available, you're open, you're an inclusive community. And it means supporting families who feel excluded and promoting family inclusion and support. And I have a reference here to Lorna Bradley's work on promoting family support groups in various religious communities. What are some individual supports that could be offered? And what I refer to here are supports when you do come across an individual who has talked about having mental health issues or might be demonstrating certain behaviors that you think might be associated with mental health issues. The first thing is to be open and direct, especially about disconcerting behaviors affecting participation. So if somebody is being disruptive in the community, it's important to talk to the individual, but it's also important not to presume that they have a mental illness or some type of diagnosis, but really focus on the specific behavior and why that specific behavior is problematic in the community. And here I refer to two strategies that can be used for this. The first is behavioral contracting, where you have a conversation with somebody who's engaged in disconcerting behaviors that are disrupting the community. And in the conversations that you have or the lay member has, you could have a conversation about why that's problematic. What are you going to do to reduce that behavior from occurring? What are you going to do next time when that behavior occurs? Will you step out of the room or maybe leave the community for a few days, maybe a cooling down period or something like that? So behavioral contracting, having a conversation with the individual, is one strategy. The second is called circles of support. And that's working with the individual to see if they'd be open to engaging other individuals, say family members, other people in the Chabad community who they would like to ask for support so they can participate. And this circle works with the individual to address potentially disconcerting behaviors. Another strategy for promoting inclusion is to obviously provide emotional support to individuals. Be available as much as possible, but also feel free to set boundaries. You do not need to do everything. So again, a lay person, another individual in the community could be available to that individual. You can say, look, I'm sorry, I'm not available right now to keep talking about this. Can you talk to this individual or this individual? You can provide referrals to mental health professionals if the person's interested, and you can identify, like I've said before, other individuals in the community who can be prepared and available to provide emotional support. And lastly, you can provide family supports. That is supports to the whole family, including the individual who experiences a mental health issue. And this event benefits Chabad because some family members may not feel welcome or might not attend because of the care they're providing with their loved ones. And again, family helpers could be other individuals in the Chabad community who are willing and available to support a family that's affected by mental health issues and address particular issues that might arise that affect that person's inclusion in the community. This kind of approach, you could also take a universal design to this kind of approach and make these so-called family helpers, not friendly helpers, family helpers, available to all families in your community and not just families affected by mental health issues.